tell me a little bit more about some of this equipment over here, and share with me about some of the nuances that have come about with the use of some of this equipment, and how that's helping take better care of, you know, the people of Kentuckiana and their eyes and vision and so forth, if you would, please.
Okay, so what we have over here is it's called a anterior segment camera, and when somebody comes in with a red eye or pink eye, of course we have to diagnose it first, and once we look at the front of the eye, assess what's going on, we can take a picture. Any disease that is that can have a chance to progress, we need to take a picture of it. So when we see it on follow-up visits, we need to make sure it's getting better. What we can see over here, this is actually a corneal ulcer, and it's generally a secondary complication to contact lens wear. This, if it was in his central vision, would be severely affecting his vision. So we take a picture of it here. We get the proper treatment as far as antibiotics or corticosteroids, and then see him back in a couple days. Make sure we take another picture and go from there.
Now, you touched on the issue of diseases, and I've heard recently, and even read some articles, that there's certain diseases that they are finding first and foremost with an eye exam, or can be diagnosed first and foremost with an eye exam before the individual even realizes they have that disease. Talk to me about that a little bit. Tell me about what some of those diseases are,
sure,
and how often I should really be coming in and getting my
sure
eyes examined.
Well, we educate and tell our patients every year, ideally, to get their eyes examined. Okay. There are a lot of diseases that can affect the eye and our vision that we can't tell on a day-to-day basis. If our prescription or vision is off or far away, it's such a gradual change. It's sort of like watching grass grow. We don't realize that our grass is growing, and we don't realize our vision is shifting.
I see your point.
And people come in, they're like, "Oh, I see fine." Well, in general, they shouldn't be driving.
Right.
As far as systemic conditions that can affect the eye, there are several. I'll point out the big ones, and that's high blood pressure, high cholesterol, and diabetes. Those are the three of the most common systemic
high blood
conditions.
pressure, diabetes, and what was the other? I'm sorry.
High cholesterol.
High cholesterol. Interesting.
Yes, that's right.
Okay.
Specifically, we see changes in the arterial and venous system on the back part of the eye. And with that, if they haven't been diagnosed with those diseases before, we send them to a primary care physician and get them evaluated. There are times that somebody is being monitored for high blood pressure or diabetes, which it still is not controlled enough, and we see changes in the back part of the eye.
Very good.
So those are the three big, high blood pressure, high cholesterol, diabetes. There are numerous other systemic conditions that affect the back part of the eye, affect not only our blood vasculature, but our optic nerve that connects our eye to our brain,
right,
and the peripheral retina.
Wow.
So,
great stuff. Dr. Matt,
yep.
thank you very,
right,
very much. Look forward to learning more and
Got it.
having a chance to do this with you again here very, very soon.
Thank you.
Thank you.